A very good morning to everybody. Thank you to all the panelists for joining for the discussion. I guess we got a good overview of what the panel is going to talk about, which is the role of technology in healthcare. What I would like to do is to probably start by having each one of you speak about your journey. What kind of white spaces did you see in and around healthcare IT, and how did you go about architecting your solutions to help the audience understand the vantage point from where each of the businesses is coming from? And then we'll probably dive into more detailed and substantive questions. So maybe we start from Gopi and sort of.
Morning, everybody. Thanks, Amit. Ironically, my journey in starting this Omega Healthcare started out because of lack of adoption of IT in healthcare. The kind of space that we are in is highly labor intensive, ironically. And it was driven because I spent a lot of time in US healthcare and understood that the myriad of healthcare IT systems in healthcare don't talk to each other. The reimbursement patterns were very, very complex. And data gathering was a real hassle, right? So providers, the healthcare providers were not getting reimbursed properly because of lack of information and whatnot, and it was still very heavily labor driven. And so my business idea was really started around leveraging the lack of integrated systems out there and the complexity that was involved in generating an actual bill for the healthcare providers to actually get reimbursed, right? That's really what started the business idea, and here we are with about 9,000 employees. So ironically, I'm on this panel, but because of the lack of IT adoption which existed way back, it has improved tremendously, I think, in the last 4 to 5 years in the US, but it's still got a long way to go, believe it or not, especially on the reimbursement patterns, which is where the money is controlled, I guess. So, thank you.
First of all, good morning, everyone. Probably I have a fairly long journey over here in the healthcare industry. We started off the company around 16 years back, right out of MBA college. And I've seen very significant changes in this industry. Today, as Indegene, what we do is we provide healthcare solutions to most of the large global healthcare stakeholders, essentially life science companies, payers, and providers. We started off in India providing solutions to the Indian pharma industry to start with, first few years, and then moved globally working with pharma industries. And we saw a very significant change happening in the pharma industry globally, where one of the biggest spend areas, around $120 billion of spend, is on detailing to doctors, right? Pharma company reaching out to doctors. And we saw that changing drastically because of regulations, cost pressures, the basic model of pharma companies going through significant changes, as they call it, the end of blockbuster era. This has been written to death now in the industry. So we saw a big change, and we realized that pharma companies will use technology to reach out to physicians, right? And we invested a lot in that area, and that's become a fairly big area of growth for us. So we provide technology, analytics, and operational capabilities for global pharma companies to reach out to physicians in multi-channel, using multi-channel methods, right? And it's a big area of spend. So that was one area, and as we were continuing to look at other areas of growth, we as a company had very significant medical expertise coupled with technology and analytics expertise. So there was clearly, we saw significant changes in the healthcare market in the US happening, because even from a pharma perspective, US was our largest market, and started investing in that area, right? A lot of driven by the regulatory changes, and that worked well for us over the last 2 or 2.5 years. Our business in the healthcare space has grown very significantly, right? And we provide solutions to payers, and very recently have started providing solutions to providers. Most of these solutions are clinical in nature, and our payments are mostly outcomes driven, at least on the payer side to start with.
Hi everyone, good morning. My name is Arvind. I am founder CEO of Attune Technologies. We are a cloud-based healthcare IT platform company. We do software for hospitals, diagnostic labs, imaging centers, and put the ecosystem together onto a common platform. We did not start off like this, right out of the B school. I used to work for Philips Medical Systems and with iSoft, which means, and I went to, do my MBA. So when we wanted to start something off, naturally I was inclined to do something in healthcare IT. So this was the definition that I had when we started. So then, we put out a founding team and we said, hey, you know what, we're going to change this world by building this great EMR product and giving it to hospitals in India. So we went to the large hospitals, few of them in Chennai and in Mumbai, and they said, you know what, nobody wants EMR here, and certainly we don't want it here. Then we said, maybe large hospitals don't like it, we'll go to the small hospital. So we went to the small hospitals. He just looked at me and said, yeah, I don't know what you're talking about, but let's see what you can do. Then I took my wife and my son, because I flew down from Calcutta. I went straight to meet him. So he liked the fact that I brought my family around. So he said, okay, let's see what you can do. So 1.5, 2 months into that, we built out the first draft version of EMR. And we went and showed it to him. He said, hey, you know what, I don't need this. I have larger issues in my operations. I don't know what kind of billing is happening, what's happening in my pharmacy, how many patients are walking in, how many beds are being occupied, a whole bunch of things that we had never thought of. Then we said, oops, you know what, we should not be doing EMR. We did a pivot and started building HIS. Few months into this, I went to a hospital again in Trichy. And there the doctor said, yeah, I have all these problems in hospitals, but I also have a larger problem in my lab. And he said, is there anything that you can do in the lab? And that was the first time I ever entered a diagnostic lab. And I'll tell you, I was totally fascinated. It was chaotic, all kinds of phone calls coming in. People were looking for all kinds of information. So I said, wow. But I didn't know if this was a specific opportunity because that this gentleman is not running the lab well, or is it an overall opportunity that we can go after in the market. So we went, and for the next 10 days also, we dropped everything that we were doing. We were at that point like 7 or 8 people in the company. So we dropped everything that we were doing and went and met more than 250, 300 labs in the country. Then we learned a lot of things out of that exercise. Then we learned few very important things. One, that we will keep figuring out such opportunities because India is evolving and getting itself into an organized way of delivering healthcare. So initially there was a HIS opportunity, now there is an LIS. So we said from a product standpoint, we'll build a healthcare IT platform that can be deployed from a single physician clinic to a statewide EHR system. So which gives us flexibility to go after segments that we could potentially evolve in the future. So that's how our product strategy evolved. And this was, 8-9 months into starting the company. From then on, we have raised Series A, we have closed Series B, but we haven't announced it yet. We have more than 200 hospitals in country as our customers. 3 of the top 5 diagnostic labs in India are our customers. And the core tech team sits out of India. And we would like to see if we can build great product sitting in India, for India, and outside India as well. Thank you.
Good morning. I am Sam Santosh, founder and CEO of MedGenome Labs. We are the largest genetic testing company in India. We very much focus on the Indian market. We're trying to bring genetic testing to all hospitals and all doctors across the country. How did I get here? That's a long story. I'll try to make it brief. I am not a biology or a medical background person. I'm an engineer by training, and my first stint was in software. I always used to be an entrepreneur, so I didn't have the opportunity to work anywhere, and nobody would give me a job. So that's the best way to become an entrepreneur, by the way. So I was in the software industry, which was my first innings, for about 20 years, and did have get into the healthcare market because I made the mistake of acquiring a healthcare software company in the US. And till then, I had a head full of hair, black hair. That stint, I lost my hair, and whatever remaining became white. And I lost a lot of money also in the bargain because healthcare is such a difficult market, especially in the US, I think everywhere. And I promised myself that I would never get back into the healthcare industry again. But memories are short, the pain goes away after some time. And when I saw the whole genome, the human genome being sequenced, DNA sequenced in the early 2000 and the draft published, hey, I saw that there was a big opportunity out there. We have the source code of life. I mean, being from the software industry, source code always gives all of us a tingle, right? If you get the source code, you believe that you can do anything with it. So whether we do, how much we do with it is left to us, but at least it gives you the opportunity. So I saw the cost of DNA sequencing falling, even much more sharper than the Moore's law. And I felt that, hey, this is the greatest opportunity. So quickly ramped up on my biology and started the genomics adventure. So our main objective is to see how we can reduce the cost of healthcare. How can we make treatment more predictive and treatment more participative? If you see the healthcare industry, a lot of money is being spent on the wrong things. Either the wrong drugs are given, and the drugs are typically developed taking everybody into consideration, not to a set of people, not based on the genetic background. So we would like to help pharma companies on the one side understand the biology of disease so that they can develop the right drugs for the right population. We try to help the patients and the doctors try to find out the genetic reasons of why you're getting a disease. Why is one person getting it? Why is the other person not getting it, even in the same family? Why is some diseases going across families, in families? What are the things that are there which is driving this? So how do we solve this at the root? So that's a journey which I hope to do in India, and I hope that we will be able to make some difference to the country. Thank you.
Good morning. Good morning. My name is Jagdish Moorjani. I am a co-founder of and the Chief Operating Officer of Citius Tech. Citius Tech is a company which is focused on providing technology services and technology solutions in the healthcare IT space. We are probably in our 11th year as a company as I speak. The company had an entrepreneurial beginning. So the founding team of the company were essentially entrepreneurs. The reason why we opted to be in healthcare IT, so there were two reasons behind our choice. Prior to Citius Tech, the chief executive officer of the company and one of the co-founders, my colleague Rizwan Koita, so he and myself were the founders of a business process outsourcing company, which was acquired from us by the Aditya Birla Group, about 12 to 13 years ago. And business process outsourcing was essentially large in scale, and it was lower in value. And having had our first experience as entrepreneurs, in our second stint, we wanted to focus on a play which was higher in value, even though it might be lower in scale. So that's essentially one of the criterion we had set out for ourselves. And as we looked at the different white spaces out there, one of the areas that we identified, which was very complex, like Sam mentioned, it was very fragmented. And because it was fragmented, it had in some ways not attracted the attention of many of the large players who were already there in the technology services space. It was also an area which required a fair degree of domain expertise. And this area was the area of healthcare, IT, and technology. So having identified that white space, we started focusing on it and systematically building a technology services company around the theme of healthcare IT. We recognized it was an area of tremendous pain, very high cost, lots of inefficiency in the US. And as we systematically worked through that space in a typically entrepreneurial fashion, the company has had the opportunity to have a fairly high rate of growth. So we are close to 2,000 people in the company today, working with several of the largest names in the area of healthcare. Over time, we have also added our own mix of solutions and solution accelerators to essentially again fill niche white spaces in the area of healthcare IT. And that's also a very exciting and interesting part of the business of Citius Tech. About a year ago, we felt that there would be value to our business from various dimensions, be it public standing, be it access to capital, be it better governance, be it access to prospective customers, be it recruitment, Considering all of these aspects, we actually raised a round of private equity funding in the company that was led by GA, who Amit. So in fact, Amit was closely involved in that entire transaction about 18 months ago. And since then, the company has continued to grow from strength to strength. Overall, the entire area of healthcare IT is extremely exciting. It's extremely challenging. And in many ways, at least if I look at the US, I think it's at a cusp. Because of several regulatory changes in the US, there has been a huge adoption of IT systems in the US, especially on the clinical side. And the adoption of these IT systems, opens up a vista of several, new opportunities. And I have no doubt that these opportunities will, contribute to making healthcare more efficient and increasing the overall quality of patient care while reducing the cost of patient care. So at CITIUS Tech, we are looking forward to being, a part of that journey as well, as in some ways we enter our, second innings as a company. So, yeah.
Oh, thank you. This is very helpful. As we can see, we got two big trends that the entrepreneurs on the panel have tried to focus on. There are three entrepreneurs who looked at the US healthcare market and thought about how could they make changes in the healthcare IT adoption and the cost of care in those markets. And the other two have essentially taken the challenge of thinking about the Indian healthcare market, which is significantly different from what's happening in the US. I think what we'll do for the rest of the panel is try to break it into these two themes so that we could narrow down a bit more on the sets of opportunities that exist in both these dimensions. So I guess, Gopi, Manish, and Jagdish, you guys mentioned about the role of government, the regulatory changes in the US healthcare market, and the fragmented nature of healthcare IT that exists. It'd be great for you guys to comment upon how has that shaped the market in the last few years, and what are the 2 to 3 large sets of opportunities that you see we all will witness in the next 4 to 5 years coming from the trend of value-based care, role of government, and payment reforms that are taking place in US?
Thanks, Amit. I think, healthcare IT is such a large industry in the US. There are almost about 4,000 plus IT vendors, right, that provide like various systems and products and whatnot in the US. And surprisingly, the amount of money that companies spend in the healthcare companies spend in IT was a dismal 2% for the longest time, right? It never improved beyond that. And just about 4 or 5 years ago, the government really took it seriously in terms of, technology is pervasive in most other industries, but it wasn't like that in the healthcare industry. So the government took a lot of initiatives, did a lot of reforms, did a lot of regulatory changes, and came out with things like Meaningful Use Act and High Tech Act, which really forced a lot of technology adoption, IT adoption in various constituents of the healthcare industry, right? People were incented to adopt IT. Things like EMRs have been talked about for, I don't know how long, 25, 30 years. Ago, there were EMR systems, like Arvind was saying. The adoption was very poor. Just in the last 4 or 5 years, things have accelerated really, really well because of the government involvement and the government push and the incentives and also in some cases penalties if people don't use or implement electronic medical record systems. They were actually tax penalties, right, that the providers had to pay. So that drove a tremendous amount of adoption, and right now it's a pretty good spend. There are 7 stages of technology adoption that have been defined very clearly in the U.S. I'd say majority of the industry today is probably at a stage, probably 3 to 4. There are very few companies in the stage 6, very, very few companies in the stage 7, which is completely automated things, right? So I think it's in the next 4 to 5 years, I think we're going to see a huge push towards more companies going towards stage 6 adoption, which is a tremendous amount of automation and IT. And I think all this leads to eventually, excellent data gathering, right? That happens at the point of care, post point of care, and then which leads to, the evidence-based medicine, which I think Sam is more apt to talk about. Thanks.
So clearly, government regulations we see play a very significant role. In India, especially, we talk about the whole HIT Act, which made every provider spend a lot of money, or rather get money after implementing IT systems. But what we are seeing as indigene in the marketplace right now, government has actually implemented a lot of policies which determine not only reimbursements for putting in IT systems, but incentivizing outcomes, right? And for achieving those outcomes, you got to have IT systems in place. I'll give you an example of 2 areas where we already see scalable entities being formed. Most of them are US in nature, and we are competing in those spaces. There's this whole area of called risk adjustment in the United States, right? In pre-existing, government came up with this whole concept that you cannot provide insurance pricing based on pre-existing conditions and a host of other factors, right? Only 3 conditions is based on which you can do your pricing. And you have these new co-ops. Last few years, 20 co-ops were formed. These are insurance companies based on the whole Hicks model and stuff like that. Now, the biggest issue all these companies were facing, most of them are commercial plans, that how do you price risk, right? If you're going to remove all this stuff. And the solution to that from a government perspective was that we will clearly define methodologies where in a particular region, let's say New Jersey, every plan would do a risk scoring of their members, right? And submit it to CMS. And finally, average of that region scores are taken. And if your score as a plan is lower, then you have to pay money to the government, right? And if it's a higher score or risk, then you get reimbursed. Okay, now the biggest issue which was happening in this case was that the provider incentives are not aligned with the payer incentives, right? So provider might enter something. For example, let's take a very simple example of a patient has hypertension, right? But provider, while he's, and also diabetes, but the way the ICD coding is done, that you only, or the coding is done essentially, you define only diabetes or hypertension, right? The risk scores in these kind of going to be very different, and what finally the plan pays out is going to be very different. I just met a plan 2-3 weeks back in US, where there's a small plan, close to $500 million, and they have to reimburse $70 million. And the CEO is saying, you know what, this doesn't add up. Now, clearly, there is some issue. So what we did is create these clinical algorithms which will go into medical records, claims, right, and identify so-called what we call suspect cases, right? This doesn't look right. If this guy was given this medicine or he had this lab test, then his score from HCC perspective, which is the risk scoring, doesn't look right. Throw those suspect records and then go and finally, in fact, get into the doctor's clinic, pull out those medical records and recode or and resubmit them for your payment. Similarly, this whole area of quality, where based on Medicare payments, which is the largest spend in the US, around 60-65% of spend is in the whole Medicare side. The government has introduced something called star ratings, right? And the plan is going to be rated on a scale of 1 to 5. And if you are below 3, then you are out of, you can't even administer those programs. Between 3 to 5, you get bonus payments. One of our clients, a large payer, more than $15 billion in revenue, lost $100 million in bonus payments because they lost half a star rating. And the entire, there's a huge team which got sacked because there's a straight hit to the bottom line, right? And the star rating, out of 80 parameters which go to calculate a star rating, around 50 are clinical in nature, right? Which you need to measure and impact regularly every year. And CMS is changing the cutoffs and thresholds for star ratings every year, right? So raising the bar every year. Now, to enable these kind of outcomes for companies themselves, have to put IT systems in place, right? And everybody is scrambling to get not only the basic systems in place, but more advanced systems, because there is a clear top line or bottom line impact given those things. We're talking about US on one hand, but what's going to be interesting to see is China as well, right? Last year itself, on the pharma side of things at least, the government had a huge crackdown on the way pharma companies work with doctors. GSK was fined a couple of $1 billion. There's a huge controversy which is all over press, and you could see how pharma companies very rapidly started moving towards different ways of reaching out to physicians, right? And we're already seeing some signs of more private investments in hospitals, which is China's again a government-driven market. But there's huge amount of investments happening in the hospital space. So governments do clearly play a very significant role over here.
So, if one looks at healthcare in the US, right, which is a market that I am personally more familiar with, a lot of the behavior in the healthcare market is driven by financials and by economics. So although in some ways, healing and teaching are regarded as the two noblest professions, the simple reality is that a lot of the actions which, all of the entities in the healthcare space take, all of those actions are largely driven by financial considerations. If you look at the, what the US government did, through the implementation of the High-Tech Act, so the full form of that act is, Healthcare Information Technology for Economic and Clinical Health. And that was an act which was, brought into place by Barack Obama when the US was going through a recession. I think one of the things that that act did was to ensure that IT starts to get used with the aim of accomplishing, amongst various other, objectives, just increasing the quality of patient care. So in the year 1999, there was a study which was carried out by the Institute of Medicine in the US. And what that study found is that every year, there were 100,000 patients who died in US hospitals because of avoidable medical errors. Now, if you think about it, right, 100,000 people is like one plane load of passengers crashing every single day. So imagine for a moment that the airline industry operated in a mode where either one Boeing or one Airbus plane crashed every day. Then how would we react, as a society to try and make sure that the planes were safer to fly? It's quite interesting, right, that there are some Senate hearings underway in the US right now, and based on latest findings which have been submitted. So when these findings were submitted, many years back, that number of 100,000 was challenged and many people were upset about the numbers. New numbers which have been shared with the US Senate right now indicate that that number is 500,000. So that's like 5 planes crashing, every single day. And if that's the number in an environment or in a society, which is a kind of, a significantly more advanced society when it comes to the overall value to human life, such as the US, we can only imagine, what the cost of avoidable medical error will be in a country like India. So if you look at what's happening in healthcare IT, right, I think the role of, technology in avoiding medical error, in picking up possible gaps in care, in just reducing the risk to human life is very, very, fundamental. We may all have some of our own experiences. I have experience of my younger son who went to his ophthalmologist and he was prescribed some medication. And, after he had taken it for a while, my wife just accidentally discovered that the dosage was 1,000 times what it was supposed to be. So she rushed, to the doctor, who is a very, very responsible, well-known, a well-reputed doctor. He immediately acknowledged his error, and he gave my wife comfort that, the medicine will just get washed out of the system, and there is no health impact or no, long-term impact. But if you think of the simple IT tools which could have prevented a medical error like those from occurring, right? I think, those are, so that kind of is really where technology will start to impact the lives of, all of us on a go-forward basis. Again, at the other end of the spectrum, right, there is a whole interesting debate which is underway about whether technology can actually replace physicians. So imagine for a moment, right, that we have technology such as big data. You have all kinds of diagnosis codes, you have all kinds of procedures, all kinds of medication, all the data that one could possibly want, right, which is kind of going into systems. And there are actually entrepreneurs, there are, investors who are starting to back themes of how technology can be used more and more to really reduce the dependency on doctors. I'm sure our doctor friends here will not be very happy to hear that. Clearly the consensus is moving in a direction, right, that technology can never ever replace doctors, and technology can at best help doctors to do their jobs more efficiently. I was mentioning to some of the co-panelists outside that IBM has recently bought medical imaging company. So they've invested $1 billion to buy an imaging company called Merge Healthcare. And IBM is now going to be using Watson, which is its advanced system of artificial intelligence and analytics to see how Watson can be used to help radiologists pick up conditions from various medical images, which they would not have been able to do previously, because the computer's ability to look at several thousand images clearly beats whatever we can do as a human being. So again, as we go along, we will hopefully start to see technology used more and more, driven by financial considerations, and a very, very important benefit will be the use of technology in making the world a safer place. So.
No, thank you. I think those are all great comments. If I just summarize, I think the way the US healthcare IT market is evolving, and if one has to think about building business in those segments, you got to think about the government reforms, you got to think about economics of various constituents, and ways in which you can leverage data, something that has come up over the last 5 years, and frankly, nobody knows what to make sense out of, as 3 tenets on which you can build a very credible and a valuable business. One that will have a great market appetite, because the entire industry, an ecosystem from all factors, is sort of bracing it. I guess just moving on from there to contrast, what is it in India as we are witnessing versus the US healthcare market? Sam and Arvind, it'll be great if you could comment upon how the Indian healthcare market is different from US, and what do you see as the evolution of healthcare IT and the triggers for the same in the Indian healthcare market?
Sure, Amit. But just before that, you spoke about software replacing doctors, but I have a case study of at least de-skilling, right, which I would like to quickly touch upon. So one of our very large lab customers, and I'm not going to name them, in their largest lab that does about 10,000 reports a day, 60% of the report nobody sees, right? So NABL has come out with an auto verification standard. So you go and put the sample in the analyzer, results go out automatically from the system. Now, it did 2 things, right? Imagine you have 10,000 reports that needs to be validated by doctors sitting and approving every one of them, as against bunch of rules-driven decision support system which auto-validates. What it led to was whatever reports that came to them for validation, they knew that there is potentially something wrong with it. So technically, they went and took a much more closer look at those reports as against scanning all the reports, in which significant percentage of them were actually very standard default reports. Now, the mandate is to see how much percentage we can increase from what it is today, and to see how far we can do that, which does, from a business standpoint, significantly de-skill, so that you are able to deploy diagnostic lab facilities in rural areas and make it extremely cost efficient to deliver healthcare to rural areas, and also bring expertise back centrally, right? So it may not fully replace for sure, but then I think there is significant value in at least de-skilling a lot of work that is being done today. Now, coming back to your question in terms of, India is fundamentally different, right? Health insurance is just beginning to pick up. Government is just starting to talk about National Digital Health Mission. So there are 3, in my mind, 3 large drivers. One is health insurance penetration itself, and there are 2 kinds of health insurance penetration. One is government being payers. So in southern states and in few other states as well, in Tamil Nadu and Andhra Pradesh, for example, government pays health insurance premium to treat poor patients for free in private and public hospitals. Now, if you think about it, government could have actually gone, and it's about 800 crores per state. So which means both the states put together, it's about 1,700, 1,800 crores. Andhra Pradesh is slightly bigger than Tamil Nadu. Now, with this kind of money being spent every year, government could have actually gone ahead and built hospitals, right? So which they did not do. They said, we will be the payer and we will let the existing hospitals, both public and private, to treat poor patients for free. Now, what this led to, and roughly about more than 1 crore people in Tamil Nadu got insured overnight, which was not the case before. So below poverty line insurance schemes are picking up and picking up very fast. It's very populist and it serves a lot of value. As a consequence to this, the number of patients who are coming to hospitals and which are being paid by insurance companies is on the rise. Otherwise, what used to be an out-of-pocket expense, so if I have money, I will get treatment, right, essentially, but which is now changing to see that the insurance company is paying for treatment for poor people. So which means there is an additional 750, 800 crores per year that is going into the system, which was not there before. At the middle class, upper middle class level also, insurance penetration is on the rise. So insurance penetration is fundamentally changing the way in which revenue dynamics work for the hospital. As a consequence, they are looking at IT systems that can help them manage the insurance processes, which was not there before, right? One big driver. The second driver is private equity venture money in healthcare provider space, right? We have seen hospitals, labs, daycare centers and whatnot getting funded. So consequently, they are looking at scale. Now, when you want to scale an enterprise, you want to see how to put standards in place, how to put standard mechanisms in place. And naturally, you want to see how can you put a standard software that puts all these pieces together. What is also happening is most of the private equity venture funded healthcare providers are all multi-center in nature. No one is going ahead and building 1,000-bed hospitals, but lots of them are going ahead and building lots of small hospitals. So cloud-based technology is something which is of significant value. Third thing is on the government side. Government operates in a slightly different way in India, right? Health is a state subject in India. So central government cannot go and say, hey, do this, right? To states, it's not going to happen because health is technically a state subject. And in a federal democracy like India, so it takes a bit more time and very smart policies to drive some of the healthcare initiatives. But however, what they have done, which I think is very smart, is they have said for reimbursements and for accreditation, you need to get NABH, NABL or JCI, a bunch of specific accreditation that have been listed for treating government patients. So if you want to treat government patients and get reimbursed, you need to be at some standard. So if you want to be at some standard, you need to have some IT systems, reasonable IT systems in place so as to get to those standards, which is driving healthcare IT adoption. The second thing that's happening with the new government is the digital health mission, where we are looking at automating government institutions starting from sub-centers at the bottom to primary health centers, community health center, district hospital and medical colleges in state. So now we are looking at a single patient record system across the states. Now, if you compare it with the US situation, we are trying to see how to connect multiple hospitals together to bring in accountability to see whether the test that is done in this hospital can be used in the other hospital to bring down costs. Now, we are in an interesting situation where we don't even have basic transactional IT systems in place, so we can directly go and put cloud-based IT systems or next generation mobile-first cloud-based IT systems in place and technically jump the curve which the US had to go through. So at one level, what baggage that US carries because of all the IT adoption that happened in the past, we don't have to carry and we could jump the technology curve, right? Which is what I think will happen in India. We have seen it happen in other areas like in retail, in e-commerce, in connectivity, broadband, mobile. Technically, with the government's health mission in place, that is certainly possible in the government sector.
A few minutes. My thoughts are that India should in no reason or no way adopt the practices, healthcare practices that are prevalent in the West. Our challenges are so different, and the way the healthcare delivery has been implemented in countries like the US has no merit to being copied here in India. First of all, I don't think there is a crime in dying. So the person should be given the dignity of death. So which still is not there in the US. So if you look at their costs, and they say trillions of dollars are being spent on healthcare, about 60 to 70% of that is spent on the last few months of a person's lifetime, right? About 50 to 60% of people don't use it at all, use healthcare at all. The rest is used by this other part of the population, and of that, a majority goes into just prolonging the life for a few months, mostly from cancer or other debilitating diseases. I'm not saying people should be just discarded and go to and die, but there are many other ways of traditional ways of taking care of older geriatric population instead of pumping into them chemicals and getting them bedridden and doing operations and and leaving them like that. So we should look at it differently. And we can, because fortunately we have a long culture and a heritage of taking care of the sick, and we can use the new technologies and the new procedures that are available abroad, but we should use it in a more cleverer way in applying them to our country. So two things which I would like to suggest. One thing which we need very badly from a genetic point of view is that we don't have data. All the research that has been done in the West has been done on Caucasian population. So we are different, right? And amongst us, the Indian population itself, there are about 4,000 to 4,500 population groups, which has been interbreeding over the last 2,000 to 3,000 years. So our genetic differences within us are also significant. This is not a very minor factor. It's a very important factor for tailoring the treatment, the right treatment to the patient. Secondly, we carry a large burden of genetic diseases, much more than any country in the world. So about 5 to 6% of the children born in India carry some harmful genetic disease. Now, a lot of this can be discovered much early. They can be prevented, and parents can go career screening. There are so many things that can be done at a very cost-effective manner, and the burden of this can be reduced. So these two things, research to find out the genetic variations, simple cost-effective tests may be funded by the government that will prevent many of these genetic diseases occurring at all. From an IT point of view, I think the IT structures can very well help a lot in implementing this. But one of the important things which IT will have to do is that IT solutions, they will have to have better systems to capture the clinical symptoms at the point of the doctor meeting the patient. Because I'm talking from a very selfish point of view, from the point of view of genetic diagnostics, it becomes impossible to look at the genetic results or the genetic report if you don't have very accurate clinical data. I'm not just talking about the reports, the clinical reports, I'm talking about the symptoms that you can capture, you need to capture from each patient. So these are things that on one side, on the front end, that a lot of software will need to be developed. On the back end, the genomic sequencing will provide terabytes of data. So this is a level of data which systems are not typically designed to handle. So the storage systems, the transmission systems, the security, all that will be needed to manage this will also be very important. Now, all these challenges provide great opportunities. So for the entrepreneurs here, I think there are hundreds of opportunities right in this small area of genomics. I hope some of you will at least take that challenge up.
I think that's very helpful. If I have to just summarize the comments that we heard, while US is about efficiency, and I think people are focused on that, India is an opportunity on infrastructure. I think there are no systems available, which allows entrepreneurs a once-in-a-lifetime opportunity to sort of create and define that landscape. With that, I think we'll probably end the session and thank all the panelists and audience for a good discussion. Thank you. Over to you.
Thank you.